Welcome to The Explainer. Today, we're going to tackle a topic that affects millions of women but is still, pretty misunderstood. Polycystic ovarian disease, or PCOD. We're going to demystify it for you using a super clear, doctor-reviewed guide from the medical team over at Arka Anugraha Hospital. So if any of that sounds familiar, like really familiar, you are definitely not alone. The answer could be a hormonal condition that's way more common than you might think. Get this, 1 in 5. That's how many women in India are affected by PCOD. It's one of the most widespread hormonal issues in the country, and what's wild is that this rate is actually higher than the global average. So yeah, this is a big deal.
Okay, so with that staggering number in mind, what is PCOD really? Let's break it down and get a crystal clear definition.
All right, so here's the deal. During a woman's reproductive years, her ovaries start producing a whole bunch of immature or kind of partially mature eggs. Now, instead of one of those being released during ovulation like it's supposed to, they just hang around. They build up in the ovaries and form these little cysts. This whole process throws the normal cycle way off and is what kicks off all those symptoms.
What's so interesting here is just how varied the symptoms are. It's totally not a one-size-fits-all thing. But here's the key takeaway from the experts. If you're consistently dealing with 2 or more of these symptoms, let's say irregular periods and that stubborn weight gain, that's a pretty clear signal that it's time to pay attention.
Okay, now let's clear up something that confuses a ton of people, the difference between PCOD and PCS. You hear them used interchangeably all the time, but nope, they are not the same thing. Let's get this sorted out right now.
So here's the breakdown. Think of PCOD as a condition that's mostly centered on the ovaries. It's generally milder, and you can often get it under control with lifestyle changes. PCOS, on the other hand, well, that's a different beast entirely. It's a more serious metabolic disorder. It involves deeper hormonal issues and can have more significant long-term health risks.
So, that naturally leads to the big question, why? Why does PCOD even happen? What's going on under the hood? Well, the truth is, it's rarely just one thing. It's usually a combination of a few key factors.
So, at its absolute core, PCOD is about a hormonal imbalance. The ovaries start producing more androgens, which you might know as male hormones, than they should. It's this excess of androgens that really messes with ovulation and leads to all those classic symptoms. Okay, you really have to pay attention to this next point because it's critical. Up to 85% of women with PCOD have something called insulin resistance. It creates this vicious cycle. Your body's cells aren't listening to insulin properly, so your body's solution is to just shout louder. It produces more insulin. All that extra insulin then signals your ovaries to produce even more androgens. See the loop? It just keeps feeding itself.
And then there's genetics. PCOD absolutely tends to run in families. So if your mom or your sister has it, yeah, your own risk is significantly higher. For a doctor, your family history is a really important clue.
And finally, we just can't ignore the realities of modern life. Things like a poor diet, not moving our bodies enough, and chronic stress. They don't necessarily cause PCOD on their own, but they can totally be the match that lights the fuse. They fuel that insulin resistance and inflammation, making everything worse. So, let's say some of this is starting to sound a little too familiar. You're recognizing the signs, and you suspect you might have PCOS. What happens next? What does that path forward actually look like?
Well, getting a diagnosis usually follows a pretty clear 3-step process. It'll start with a good long chat with your doctor about your symptoms and your family history. Then they'll likely do some blood tests to check all your hormone levels. And finally, you'll probably have a pelvic ultrasound so they can get a clear look at your ovaries.
Now, here is a super important point that I think gets lost sometimes. Treatment does not automatically mean medication. For the vast majority of women with PCOD, the single most powerful, most effective first step is making some manageable changes to your lifestyle.
And the impact can be absolutely profound. I mean, it might not sound like a lot, but the research is clear. Even a modest 5 to 10% reduction in body weight is often enough to dramatically improve your hormone levels, restore regular ovulation, and seriously reduce your symptoms. But of course, sometimes lifestyle changes aren't quite enough on their own, and that is perfectly okay. Doctors have some really effective tools in their toolbox. They might prescribe medications that are targeted at specific issues, like metformin for that insulin resistance, birth control to get your cycles regular, or other drugs to help with fertility.
And all of this really brings us to the core idea behind managing PCOD. This isn't about a quick fix or a magic pill. It's about shifting your mindset and adopting a proactive, long-term strategy to take care of your health.
A huge pillar of that strategy is diet. The main goal is to focus on a low-glycemic, anti-inflammatory way of eating. So you're thinking whole grains, lean proteins, and tons of healthy fats, while trying to steer clear of the refined carbs, sugary junk, and processed foods. Honestly, this one change can make a massive difference in managing those insulin levels.
And this right here, this brings us to what might be the single most important takeaway from all of this. It comes directly from the medical experts at Arka Anugrah, and it is just such a powerful message of hope.
So let's get this straight. The goal isn't a permanent cure. That's just not how this works. The real goal, the real win, is control. Because with consistent, proactive management, PCOD does not have to run your life. You can manage it so well that many women become completely free of symptoms.
So we're going to leave you with this final thought. Empowerment isn't about some massive overnight life overhaul. It starts with just one small step. So after hearing all of this, knowing that lifestyle is your first line of defense, what is one small, sustainable change you can make starting today to start taking back control of your hormonal health? That's the question that really matters.